Hello, UMA students. It's time once again for our last video presentation regarding communication, therapeutic responses across the lifespan. We have talked in the last videos about behavioral theories regarding human growth and development. We have talked about communication with infants, children, adolescents, adults, and older adult age groups. There are many similarities within these age groups and how we communicate with them, and there are differences as well. Today, we're going to take all that information, summarize it a little bit for you, and then add on just a little bit more about listening and what you can do to be a great healthcare communicator. So let's go ahead and get to it. I'm going to go ahead and share my screen, and we'll start looking at our PowerPoint. So hold on one moment. Okay, here we go. The therapeutic response across the lifespan. We're familiar with this slide. So we have our theories of human growth and development. We're going to talk about just one more time. We have our personalities and cognitive skills. They build upon each other as physical growth and maturity progress throughout the life cycle. So obviously we're not the same people we once were as children and teenagers, but yet there are similarities to our behaviors. We have had cognitive development happen where we started off where we weren't able to talk and we weren't able to take care of ourselves. And now we are fully functioning adults who are able to attend an online school, which is very multifaceted and creates a lot of, well, requires a good amount of cognitive skills in order to be successful here at UMA. As a healthcare employee, when you go to appropriately care for your clients, you must have a knowledge of the normal behavior for those specific age groups and be able to interact with their level of understanding. And that's what we're doing here today. We're trying to give you a summarization of the other videos that we made so that you have a good understanding of the people you're dealing with when you go out into the world of healthcare. We want you to be effective and efficient healthcare communicators. The healthcare professional might also need to teach caregivers how to help their clients through a particular crisis of stage of life. So we are there not only to help the patient, but also to help the caregiver. And if we cannot communicate effectively, we will not be able to provide the care that we want to provide. Okay, so first let's just review the therapeutic responses that we learned about giving to an infant. We want to educate the parents about being safe and providing comfort for those infants, because infants, the way they grow and develop is by having the physical safety and security and comfort that they need in order to feel good and to thrive. When those things are not in a child or an infant's life, then that's where you see developmental delays come through and behavioral delays. You want to be there to answer parents' questions. Parents have a lot of questions. A lot of parents aren't used to dealing with a baby and being able to understand their wants and needs. And as a healthcare professional, we want to be able to help them figure out what the infant is trying to communicate. You want to observe the parents with the infant so you can provide some tips and techniques that might help the communication improve between the infant and the parent. You always want to create a pleasant environment with the infant and the caregiver, the parent, when they come into a healthcare setting. You don't want it to be stressful. You want it to be baby friendly. And you always want to respect their cultural background. Different cultures have different ways they might feed a baby, what they feed a baby, how they talk to a baby. And you need to be aware of these things, be respectful and professional always. Then we move on to children. Children, they start to realize the importance of the environment around them, and they might not feel comfortable if the environment around them is not comforting. You want to establish a friendly relationship, and giving choices is always a popular communication strategy when dealing with children. You don't want to keep the children or the parents waiting in the exam room or in the lobby of an office, because that can cause anxiety for both the children and the parent. You want to help the child deal with their feelings. One way to do that is to get on their level, to provide that eye contact we talk about so often, to put a smile on your face and just really be friendly and help develop that pattern of trust between you and the child. You want to listen with your eyes and your ears so that you truly understand the child's feelings. Some children will talk more than others, and sometimes they express themselves through their body, whether they're kind of back off to you, holding on to their mom or dad's leg, or maybe they come in and they're showing you all of their toys and their shirt and their shoes, and they're so open and friendly. So you get your cues from the child, and with that, you know whether to be just as friendly, or maybe you back off a little bit and maybe ask them some questions. You always just have to kind of read their cues, and a lot of times those cues can be nonverbal. You want to listen to the parent's concerns and also see how the parent and the child interact. Make sure that you're catching the nuances that might be happening in their relationship. And also, if the parents have other concerns that maybe they're not directly expressing to you, you might catch something in an indirect comment that a parent says that might spark your attention and might need to be brought to the doctor's attention at a later time. Giving rewards, just like giving choices is a big hit with children, and giving rewards is also a big hit. You want to be able to provide them things that are okay by the mom, whether it's stickers or lollipops or just a high five or an elbow bump these days, but you want to make them feel good and positive about the experience. Be aware of your feelings of dealing with the children and how you're coming across and how you're communicating. And then also, like I said before, be aware of their feelings that they're expressing to you. As children grow up, they become adolescents. Adolescents, they get a little bit more private than those children were. Sometimes we need to talk to them about sexual issues that they might not want to talk about with their parent, and that can be a pivotal role of a healthcare provider, a pediatrician that an adolescent goes to see. And so you need to respect their privacy and ask them if they want to talk about it with or without their parents around. I know when I have taken my children to the pediatrician when they're adolescents, the doctor always asks me to leave the room so they can talk to my child privately. You want to make sure, as always, you are treating that adolescent with respect and dignity. They are becoming a young adult, and they are not a child, and they want to be treated as such. So you need to be aware of that, and don't use endearments and call them sweetie. They're getting a little too old for that. So you have to be cognizant of the person that's in front of you. You want to be professional and be transitioning them to adult care, where they are going to be hearing more of the information, using the right vocabulary with them about medical issues, giving them a feeling of self-worth, that they are important and deserve to be included in their medical decision making just as an adult might. Obviously, it has to be with their parents' approval, but you are working towards that transition. And then we have our adults. You want to get to know your adult clients. There can be, as we've discussed in earlier videos, there can be a lot of responsibilities on our adult patients. They can be part of that sandwich generation where they're taking care of their kids, they're taking care of their older adults, family members, and then they have all of their responsibilities on them. So we have to be sensitive and empathetic. And it could be scary also if they are presented with a significant health concern. They might be thinking, oh my God, how am I going to manage this? How am I going to pay for this? So there can be a lot of stresses with an adult patient in a healthcare setting. You want to be aware of their cultures, lifestyles, religious beliefs, backgrounds. These are things we talk about in this course, and it's because it's so important, because we all come from different backgrounds. We all have different things that are important to us, and we as healthcare professionals need to recognize those things and be aware of it. We also have to recognize our adult skills and intelligence. Even if someone doesn't obviously have a healthcare background, and you are the professional and have had more experience and knowledge about certain health issues, you want to treat them like they understand, and if they don't, that you are there to teach them and help them, whether you give them information in pamphlets, or have them look at a website, or just talk and share with them experiences you have. You want to recognize their skill and talk to them at an intelligent level. You want to emphasize preventative health care, because as we're in our adulthood, we need to take care of ourselves, our eating, our dieting, exercise, and also going to the doctor on a regular basis. We have to also respect their right to privacy and not talk about their health issues with others. We want to encourage positive thinking. Positive thinking always helps reduce stress and makes people feel better. And then those kinds of thinking patterns can help people with their health issues. And lastly, we don't want to promise specific results, because everyone is different and we are not in the place to do that. So we do have to be careful with what we say and how we say it. And then we get to our older adult population. With them, you might start to see physiological changes with hearing, with vision, with their physical abilities, their abilities to walk, to write. And they might have different diseases. They might have cognitive abilities. Maybe their memory isn't as good as it once was. So because of that, we need to allow additional time when we're taking care of them. We need to minimize background noise to make sure they are hearing and understanding what we are telling them in the healthcare setting. We want to speak slowly, use visual aids when necessary, and make sure that they feel comfortable. People aren't going to be able to get proper care and feel good about the care they're getting if they aren't in a setting where they feel comfortable with people that they trust and respect. We need to try our best to be aware of their schedule and stay on a routine. That can be very important with older adults. We want to treat them with respect and have them be as independent as possible. Some older adults might have adult caregivers, children, or other friends or family helping take care of them, especially if they do not have the cognitive abilities to take care of themselves anymore. But we always want to be aware that they're in the room. When somebody is in the room and you're talking about them, you always need to be respectful and assume that they understand what you're saying, because you don't want to say anything and make them feel like they don't matter anymore. You don't want to be over solicitous and say, oh, sweetie, honey. You want to always be a professional communicator. So where does that leave us? I quickly went through infants, children, adolescents, adults, older adults. Basically, within all age groups, you want to assess their level of comprehension and then adjust your language and expectations to that of the age level, whether it's your vocabulary, your tone of voice, the way in which you speak, your body mechanics, your nonverbal communication, your facial communication. You want to do what's right for that age client and for that person standing in front of you, because it could vary from one person to the next. You want to make sure that you're giving them the right amount of information and correct information. If you don't know something, say, I don't know, but I'll check into it for you. You want to be aware that fear is often present. Little infants and children can be scared when they go to the doctor, and so can adults and older adults. You don't know if they're going to get a shot. They don't know if they're going to be told something they don't want to hear. So there always can be a little fear associated with a visit to a healthcare office. You want to communicate at eye level and position yourself so you're face to face. No matter what age group you're dealing with, that is always number one important. If a doctor comes into an office, nowadays doctors are on their computers a lot, and I find they're typing in the computer, everything you're saying, they're not looking at you. And that does take away of the communication interaction between the doctor and the patient. I know that I feel it, and you lose something there. So it's important to get your head out of the computer and really look and talk to the patient who's sitting in the room. And when you do that, you also want to be listen attentively to what they're saying. We'll talk about that more in a minute. How to improve communication between generations in the workplace. And when I say workplace, I mean your workplace in a healthcare setting. You want to set expectations regarding the workplace culture and the behavior. Know what kind of culture are your patients that come into that office generally, and what's the behaviors that you generally see, so you know what to expect depending on what kind of office you're working at. A lot of times offices are structured more for different specific age groups, but sometimes a cardiologist is mostly going to see older people, a pediatrician is mostly going to see younger people, but then there's some practices like a dermatologist who deals with people's skin. They might see young kids and older people, excuse me. So you need to kind of know who you're dealing with. And with that, you're going to want to use different types of communication depending on the age group. So you'll want to personalize the approach that you use on how you communicate with them. You need to understand that there's differences in their values and motivations, why they're there, what they're seeking. And always ask questions. Don't assume you know why they're there or what they want. Ask, be sure. You want to remove the barriers to communication, whether it's making sure you're sitting face to face so they can really see you, whether it's background noise, whether it's somebody else in the room being distracting, or like something in the room that's making a lot of loud beeping noises. You want to make sure you remove those things. And lastly, be willing to teach your patient and their caregiver, and also be willing to be taught by them, which also comes again to listening and being a good listener, which is where I want to end this presentation on. Listening. What is active listening? It is building trust and establishing a rapport. Sometimes that might not happen on the first visit. It might take a few visits. That's why if you find an office where people have worked there a long time, I think that's a good sign. It means people enjoy working there. The supervisors and management do a good job with their employees. And hopefully you'll have some patients that come in who come in often, and you can really build a nice relationship with them. You want to demonstrate concern. Sometimes that can be how you put your body, putting your ear, putting your eyes, really looking at them, showing that you care. Another way to demonstrate active listening is to paraphrase to show understanding. So if someone says to you, I'm not feeling well, I'm having trouble sleeping, I don't have much of an appetite lately, then you might say, okay, what I'm hearing from you is that your sleep and eating patterns are not what they used to be. And then the patient knows that you heard what they said and that you understand what they said. You want to use nonverbal cues which show understanding, which such as nodding your head, your eye contact, and leaning forward. Also, the way your body might be positioned. Brief affirmations such as, I see, I know, sure, I understand. But it's also good to back those things up. If you just say, I understand, say, I understand that you're not feeling well. Really show them that you're listening. As we've learned in previous parts of this course, you want to ask good questions, whether they're open-ended questions or closed questions to get specific facts, and then open ones to get more information. Or sometimes those closed-ended questions can help give you clarification as to when and why something is happening to a patient. Be patient. You want to give them time. Sometimes people can take a little bit to think about how they want to say something. So give them time to respond, and then wait until you get all the information to disclose your opinion. You might also want to disclose similar experiences. Of course, always keep in mind the rules of privacy, but other anecdotes that you can explain to show that you do understand what the person is saying to you and why they're having a problem. Now, these traits can come when you deal with infants and their parents or caregivers, and on through the ages as you go on to adults and older adults. So these active listening techniques will help you no matter what age range you're communicating with. So we've reached the end of another video, and I'd love to know what questions you have, but I'm here and you're there. So if you do have questions, please direct them to your instructor. Look in your textbook. This information has been taken from your SunGage course, your SunGage textbook, and other UMA platforms. So the information is out there for you, and like many things with communication, practice takes perfect. Think about the communication you do on a daily basis and think about how you can improve that. These techniques that I've talked about are not just only for when you work in healthcare, they can be for your current job or your current personal relationships. Reflect on what I said. As always, use this information to help you with the course content, with your assignments, your assessments, your interactives. Use the readings, the UMA library, and other reliable sources so you can maximize your learning. It has been my pleasure helping you throughout these videos. Again, my name is Vicki Weissman. I'm a UMA instructor, and I hope you all have a wonderful day. Thank you so much for listening.